Good morning on Sharp 2020 channel. Today is 19th November 2020 and we have breaking news. A new COVID-19 vaccine was finally produced and there is a plan to make its use widespread under an expanded access program. An expanded access, also known as compassionate use, is when a new intervention under investigation is used outside a clinical trial, typically under emergency circumstances. The product would not be approved for use yet, but it would have been evaluated in a preliminary fashion for its efficacy and safety in animals or human subjects. Typically, expanded access programs for drug use have already been used for COVID-19. The idea of the use of expanded access of a COVID-19 vaccine is under investigation. We have reached out to multiple experts in the field to see what they think about it. Our first interview is going to be with a French scientist, Françoise, who developed the vaccine.
Hello, can you hear me? Okay, d'accord. So to answer your question, given that there are no approved or available alternatives, it is reasonable to believe that the vaccine may be effective in preventing the COVID-19. But the potential benefits might outweigh the risks. We have to keep that in mind. So the fastest way to know this is to market it, for example, in Africa, where the benefit would be the highest, given, the lack of the proper treatment modalities. So the prevention would be key. Merci.
This was the response of Dr. Dalia Tarawi on Twitter. Next, we interviewed Danielle McBash, CEO of BioVax, the vaccine manufacturer.
Thank you so much for your questions. So we're currently working... Thomas, I have a conference. Sorry about that. So we're currently working with all the governments who are willing to protect their populations, and so far we've had 3 African countries who will be launching the compassionate use program by next week. Thank you.
And this was the response of Dr. Farah Gulehan on Twitter. Next, we interviewed Dr. Zain Kanafani, Director of the Infectious Diseases Control Program at the Ministry of Public Health.
So, where expanded access is to be applied, the vaccine should be fairly distributed among all the Lebanese people, with no discrimination whatsoever based on financial status, sect, political affiliation, or even vulnerability, such as prisoners or refugees, under the pretext that they are high-risk populations. It should be made accessible across all the country's hospitals, and it's also the physician's responsibility to educate the patients about the presence of the vaccine and to make sure that the patient is eligible. And furthermore, all practicing physicians should be made aware that offering the vaccine to the patients is an option, and that patients should be informed before they consent to take the vaccine.
Okay, thank you. Finally, a group of bright Sharpies have recognized the emergent need to elaborate policies for expanded access program, comprehensive policies, whether for COVID-19 or other diseases. They recognize that the world we live in today is volatile, uncertain, and complex. The policies they came up with, under the name of the Beirut Report, ensures the highest ethical standards for compassionate use of new vaccines. Following are its major points.
Under the Beirut Report, point 1, informed consent. The patients should understand that the vaccine is still under investigation. Point 2, there should be a clear rationale for using the vaccine in a certain population, for example, in disease-prevalent populations where the benefits are likely to outweigh the risks, and that the country is equipped with appropriate medical capabilities should any adverse effects arise, and that the patients are covered or insured. Point 3. No financial conflict of interest with the national body approving the program and the company marketing the drug. Point 4. Expanded access requires not only the government's authorization, but also active involvement of healthcare workers in the regular follow-up of patients and reporting of any adverse outcomes to both the Ministry of Public Health and the drug company. Point 5. Expanded access program can be interrupted in case of severe adverse effects, morbidity, or mortality.
That's it for today. Stay tuned on Sharp TV for more news on COVID-19. Good night, Beirut.